Yeah, so like many of us, we had evacuated to Baton Rouge, and we were staying with a family. One of the members was working at the Department of Education in Louisiana, and she came home one day and said, they're talking about like mental health in schools, coming up with a plan. Maybe you'd like to join them. And I said, yeah. So a couple phone calls later, I was at this meeting and got in there, and there were some school officials kind of still figuring out the evacuation using school buses. And so that was kind of their focus, is getting people out of New Orleans using their own buses. But about 20 minutes later, as we got into the conversation, it was real apparent they had no plan for mental health in schools. And so I left that meeting, I think that was a Friday, with the task that weekend of putting something together. And so I did a lot of research over the weekend and put together something that I believed represented evidence-based practice, what we knew at the time as evidence-based practice for disaster mental health, and something that would work in the schools, because I knew that jobs, homes, and schools, including daycares, would be necessary for the rebuilding of New Orleans. So the focus was children in schools. Yeah. I think we all believed that children who came back, whether they were exposed to the storm themselves or to the toxic environment afterward, would all need mental health services. It would be trauma. And so we developed something called community classroom consultation, where counselors would bring in students that they were worried about. In this way, we could systematically, and more importantly, I guess as a team, look at each child and understand what their history was. Was this about the hurricane? Was it something that was pre-existing? Because we have to remember that everybody, adult, child, had pre-existing stuff, and it could have been trauma. One major confounding factor was the shift in schools. A lot of our kids needed, and probably the number one referral was for educational testing. Why? A couple of reasons. One, sadly, was that kids, when they shifted from one school to another, landed in a place that likely had higher expectations. And so we had kids that were literally undereducated, which was sad to see. But we were able to identify them with some monies and some systematic psychoeducational testing. The other, as sad, were kids were not identified as having some sort of special need, whether that was being on the autism spectrum or having a learning difference. Kids were under-identified. And that too led kids to services that could provide not only assessment but some type of remediation. And the initial launch with the state didn't go as planned. Other players came in and we were kind of pushed aside. We revisited the plan with Catholic Charities. They had some monies and interest in supporting mental health in schools, with particular interest, of course, with the Catholic schools, but people need to know that we did not just start in the Catholic school system. We started in both public and private. It took a couple months to organize ourselves. It was Catholic Charities, a few other smaller organizations devoted to mental health in schools. Save the Children was one of them, and we used actually one of their programs as a kind of a surveillance program.
As agencies and nonprofits began to come together to build this support for children and families in the city, Project Fleur-de-lis quickly rose as a leader. They worked tirelessly and collaboratively with other groups and schools to make sure that there was an equitable distribution of resources and supplies for all children and all schools as they reopened. As psychosocial program manager of Save the Children Katrina Response, I had the unique opportunity to work with Doug Walker and his team to create a tiered system of supports for youth and children in the schools. Save the Children's Journey of Hope was a resilience-building universal intervention, and Project Fleur-de-lis was then able to provide tier 2 therapeutic support for those children needing more help. And because of their relationship as an initiative of Mercy Family Center, they were also able to provide individual counseling for children who needed such individual work.
Yeah, although our view at the time was probably, looking back, pretty myopic in the sense of being totally consumed with Hurricane Katrina, and more importantly, really the toxic environment afterwards. We knew in our heart of hearts that that would someday fade, and that we would sadly return to the everyday here in New Orleans, which was community violence. And with Laura's help, Laura Dana, we were able to turn or shift, or really, I guess in some ways, pivot from disaster mental health to more community needs that were coming back after Katrina, which included community violence, but also included domestic violence, and more recently, the focus and strong need for suicide intervention. Yeah, I believe that mental health is necessary for learning, and so it's safe to say that mental health should be provided in schools. To what degree, that depends. Sadly, we're underfunded for the simplest things in schools, school supplies. But mental health is not a luxury, and I believe it needs to be provided in schools. I think Project Fleur-de-lis has the flexibility and the foresight to always be in tune with our community's needs. This new world of telehealth, post coronavirus, someday soon, will continue, and I think Project Fleur-de-lis has the opportunity to expand their programming beyond just the greater New Orleans area. So I believe that the future of Fleur-de-lis is bright in a couple ways. One, I know that they'll always hold on to best practice and defend that, and always provide the best to the community, whether it's trauma-informed care in schools, whether it's suicide intervention, but they're innovators as well. And so along with need comes this idea of innovation, and I'm excited to see that innovation as it applies to this kind of brave new world of telehealth and telemedicine.